Advanced Respiratory System Block for the 7th semester of medical school. The Advanced Respiratory System Block aims to provide medical students with an in-depth understanding of the anatomy, physiology, pathology, diagnosis, and management of respiratory system diseases. The primary focus is on common clinical respiratory disorders and their management in both elective and emergency situations. 1. Anatomy and physiology of the respiratory system. A. Anatomy of the respiratory system. Macroscopic structures, upper airway, nose, paranasal sinuses, pharynx, and larynx. Lower airway, trachea, bronchi, bronchioles, and alveoli. Lungs. Right lung, 3 lobes, and left lung, 2 lobes, visceral and parietal pleura. Diaphragm and accessory respiratory muscles. Blood vessels, pulmonary arteries, carry deoxygenated blood to the lungs. Pulmonary veins carry oxygenated blood to the heart. Lymphatic system, lymph nodes of the hilum and mediastinum. B. Physiology of the respiratory system, ventilation process. Inspiration, active process, and expiration, passive process. Role of intrapleural pressure and lung elasticity. Gas diffusion, exchange of O and carbon dioxide in the alveoli and pulmonary capillaries. Perfusion, blood distribution in pulmonary capillaries for gas exchange. Regulation of respiration. Role of the respiratory centers in the medulla oblongata and pons. Response to changes in carbon dioxide, O, and blood pH levels. V-Q ratio, ventilation, perfusion, ideal condition, V-Q equals 1. And abnormalities such as shunting or dead space. 2. Pathology of the respiratory system. This block addresses various acute and chronic respiratory diseases. Key topics include A. Obstructive lung diseases, bronchial asthma, causes. Chronic inflammatory reaction of the airways to allergens or irritants. Pathophysiology. Bronchial hyperresponsiveness, right-pointing arrow bronchoconstriction, right-pointing arrow airflow obstruction. Symptoms. Episodic shortness of breath, wheezing, cough. Treatment. Bronchodilators, beta-2 agonists, and corticosteroids. Chronic obstructive pulmonary disease, COPD, combination of chronic bronchitis and emphysema. Main causes, smoking, pollution exposure. Pathophysiology. Alveolar damage, right-pointing arrow, decreased lung elasticity, right-pointing arrow CO retention. Complications. Chronic hypoxia and cor pulmonale. B. Restrictive lung diseases, pulmonary fibrosis. Causes. Idiopathic or exposure to harmful substances, asbestos, silica. Symptoms. Progressive shortness of breath. Dry cough. Complications. severe hypoxemia, acute respiratory distress syndrome, ARDS, causes, acute lung injury, sepsis, aspiration. Pathophysiology, increased capillary permeability, right pointing arrow, pulmonary edema. C. Infectious lung diseases, pneumonia, causes, bacteria, Streptococcus pneumoniae, viruses, fungi. Symptoms, fever, productive cough, shortness of breath. Diagnosis, chest X-ray, sputum culture. Tuberculosis, TB, cause, Mycobacterium tuberculosis. Pathophysiology, granuloma formation in the lungs. Treatment, combination therapy with anti-tuberculosis drugs, isoniazid, rifampin, etc. D. Pulmonary vascular diseases, pulmonary embolism, cause. Thrombus from deep vein thrombosis, DVT, entering pulmonary circulation. Symptoms, sudden chest pain, shortness of breath. Diagnosis, pulmonary CT angiography. Pulmonary hypertension, increased pressure in the pulmonary arteries. Complications, right-sided heart failure. E. Pulmonary malignancies, lung cancer, causes, smoking, exposure to carcinogens. Symptoms, chronic cough, hemoptysis, weight loss. Diagnosis, CT scan, biopsy. 3. Diagnosis of respiratory diseases, a history taking and physical examination. History taking, chief complaints, shortness of breath. Cough, dry, productive, hemoptysis. History of smoking, occupation, exposure to hazardous materials, infections. Physical examination, inspection, breathing patterns, cyanosis. Palpation, tactile fremitus. Percussion, dullness, consolidation or hyperresonance, emphysema. Auscultation, wheezing, crackles, vesicular breath sounds. B. Diagnostic tests. Pulmonary function tests, spirometry, measures forced vital capacity, FVC, and forced expiratory volume, FEV1. Diagnoses obstructive or restrictive diseases. Chest X-ray, detects pneumonia, TB, or malignancies. Thoracic CT scan, provides detailed evaluation of lung lesions and embolisms. Arterial blood gas analysis, assesses hypoxemia and carbon dioxide retention. Bronchoscopy, direct airway examination for tumor or infection diagnosis. 4. Management of respiratory diseases, a non-pharmacological therapy, oxygen therapy, for acute hypoxemia. Mechanical ventilation, for ARDS or severe respiratory failure. B. Pharmacological therapy, bronchodilators, salbutamol for asthma and COPD. Antibiotics, based on sputum culture for bacterial pneumonia. Corticosteroids, for severe asthma or autoimmune lung diseases. C. Surgical interventions, lobectomy or pneumonectomy, for lung cancer. Drainage, for pleural effusion or pneumothorax. 5. Practical training in the respiratory system block, spirometry usage, training in interpreting pulmonary function test results. Chest X-ray interpretation, identifying pneumonia, TB, pleural effusion, or tumors. Thoracentesis procedure, collecting pleural fluid for analysis. Simulated case consultations, integrating history taking, examination, and diagnosis to plan treatment. 6. Psychosocial aspects and patient education, smoking cessation, asthma management, and adherence to TB treatment. Psychological support, for patients with lung cancer or chronic diseases such as COPD.